Hello, everyone, and welcome to today's session. My name is Crystal Fullerton, and I'm the Farm Safety Coordinator of the PEI Federation of Agriculture. Today, we're proud to present our Building a Sustainable Farmer webinar series. I'd like to introduce today's presenter, Adam MacDonald from Canada House Clinics. Adam was an LPN before moving into his present role as a cannabinoid therapy educator. Today, Adam will be discussing the value and the use of medical cannabis as a complementary treatment in your health program. It is hoped that after this webinar that you'll have the basic tools in place to help you make a more informed decision regarding medical cannabis and your health. A few housekeeping issues to introduce before we begin. First off, please mute your device during the duration of our webinar to ensure a higher quality sound for everyone. We do have a chat and Q&A section. Please pay attention as there are boxes that you can check off to ask your questions anonymously. We encourage all dialogue because we want you to get as much as possible out of these webinars. Sometimes being anonymous will help questions pop up that others were too shy to ask. Adam does not mind if you ask questions during the webinar, so please ask away, as this session is about learning about the importance of medicinal cannabis on the farm and for your health and safety. Also, there will be a poll during this webinar, and we do ask that you participate. It only takes 1 minute. It's very simple. It's yes and no and multiple choice, and it helps us and our funders to determine if we're moving in the correct direction with our webinars. If you have any additional questions after the event or suggestions for other speakers, you can contact us at farmsafety@peifa.ca. We will be providing a recorded version of this webinar at a later date, so please check out our website and YouTube channel. We would love for you to share this information. For those of you just joining us, welcome. And now I'm going to pass this webinar over to Adam MacDonald. Enjoy.
Thank you. Hello, everyone. As Crystal explained, my name is Adam MacDonald, and I am an LPN, and I work for Canada House Clinics, and my position with the company is a cannabinoid therapy educator. Prior to that, I worked in Charlottetown at the Queen Elizabeth Hospital. I worked both in acute medical and acute psychiatry. So I kind of got a view of two different sort of nursing aspects there. And I also worked in Summerside at Prince County Hospital and a little bit at Hillsborough Hospital as well. So I've been around a little bit on the island, and I've been with Canada House now since last December, so coming up on a year. I'm going to start the slideshow now to talk about our company and what we do. Oh, I need to share my screen. There we go. Okay, can everyone see my screen? Are you able to see that, Crystal?
Yep.
Okay, great. I'll go on. Okay, so Canada House Clinics is a part of Canada House Wellness Group. So we have Canada House Clinics, that's the clinic side, that's where I work, and we have different clinics across the country. We have ABBA Medics, which is actually a producer of medical cannabis, and Cannabis Technologies, which is another part of our company that works on the software that we use as a company to actually, it's called our cannabinoid patient manager software, and they sort of have developed that from the ground up. And I have to say that they are great with feedback. You know, just working with the company for a year, they certainly they listen to what I've had to say, you know, even just being new to the company. So I really appreciate that. They're great to work with. Okay, so the clinics portion, it was founded in 2013 by two Canadian Forces veterans. And they were struggling with PTSD themselves, and they had a lot of, you know, friends in the military that were struggling with it. They were being on higher and higher numbers of pharmaceuticals. They were finding it was not helping. They found cannabis much more helpful. And they founded the clinic with a goal to help people, military, and it started as a nonprofit. And the company is since now a publicly shared company, and we treat all sorts of conditions outside of PTSD and other non-veteran civilian patients as well. So our clinics, we have 16 clinics now. That is in 2020, we've opened Vancouver. So we're at 16 clinic locations, 15,000 patients served, since 2013. So we're, spread out. It was started like in New Brunswick. So, a lot of clinics in the Maritimes, as you can see there, New Brunswick, Nova Scotia, and Newfoundland, as well as Ontario, Alberta, and BC. So we're spread out across. So there's our client numbers. Active clients, 6,000, 2,800 of which are veterans. So, we've actually moved out to actually have more civilian patients than veterans, but veterans are certainly a big part of our clientele. To talk about cannabis, people used to call it a gateway drug, but what they're saying now is it's more of an exit drug. So you can see those numbers on the screen there. This is our statistics as a clinic. We found that 97% of patients reduce use of some sort of pharmaceutical when using cannabis, and that 41% actually stopped opiate use. And if you know anything about opiate use, I mean, it's very much prevalent now. There's, the opiate crisis, in North America. Certainly, it has addictive tendencies, but cannabis actually helps people get off of that. And 41% of our patients actually stopped it altogether. So I thought that was an interesting statistic. Okay, so what you need to know. So some general sort of facts about cannabis. And so it's not a new medical treatment. It was new in Canada, legalized in 2001, but prior to that, it had lots of historical use dating as far back as ancient China. And it's growing in its use today. There's more and more evidence pointing towards it. It's less harmful than opioids and other drugs, has fewer interactions and contraindications, particularly for the elderly. It's less addictive than opioids, alcohol, and nicotine. The withdrawal, you can you can be a lifelong user of cannabis and stop using it all of a sudden, and there's very little withdrawal. It's not a medical emergency at all. The same cannot be said for opioids, alcohol, and certainly nicotine. People have a tough time, quitting those. Cannabis is very diverse in its treatment. So there's different cannabinoids, there's different doses, different methods of consumption, and we'll get into that. But sometimes if you're new to cannabis, it's useful to talk to someone that may know, have experience with it. And that's sort of where we come in. We try to give people treatment plans. We look at their symptoms, what they're experiencing, and where cannabis and what sort of forms and what we could use to maybe best suit them. So, and then at the bottom there, it says it's generally not covered for many conditions, but that is changing. More and more insurance companies are starting to cover it. It usually is for specific conditions, but I've seen some progress on that even since starting with the company. Okay. Oh, before I go into this slide, I think I have to go and do a joke because at Cannabis's expense, because we have to be able to take a joke or two. So if you don't mind, the joke goes like this. So I was talking to my friend in Colorado, and this is after Canada had legalized cannabis for recreational use, and he was saying, it's legal in Canada, but in Colorado you have to have a medical diagnosis to get cannabis. Yeah, you have to have a real medical diagnosis to get it. You have to have so he says, my diagnosis is, I talked to my doctor and I said, Tuesdays make me sad. And that's what he said his diagnosis was. And I said, well, that gives an all new meaning to Rocky Mountain High. So anyways, that's the joke. I mean, okay, so that actually parlays into the next segment kind of well. Why does cannabis work? Certainly people have used it recreationally and medicinally for a lot of reasons, for a lot of different varying ailments. So here's the sort of the scientific reason why it can work, and why it can work for a lot of general symptoms associated with a lot of different diseases. So we have the endocannabinoid system. It's well described. It was described in the 1990s, relatively recently, within the last 30 years. So CB1 and CB2 receptors, those are the main two. I'm not going to get into it in real detail, but CB1 receptors, that's where you have, those are more distributed in the nervous system. So you got the brain, spinal cord, and your nerves throughout the body. CB2, you have them in your digestive system, immune system, your muscles as well. So they're distributed throughout the body. It's quite a big network, and it sort of has its hands in different regulatory processes, whether it be from sleep regulation, pain regulation, even digestion, immune response, even sometimes focus and ability to work, to do tasks. So it's quite extensive, and it's throughout the body. So with cannabis, the plant, we have two main, what we call cannabinoids, and those are the actual chemicals in the plant that seem to have the most medical use. There's 400 different compounds in the plant in very small amounts, but the highest ones are THC and CBD. And THC is the one that is associated with the traditional high that people, would smoke. But the CB1 receptors, you got the, like I said, in the brain and nervous system, lungs, liver, and kidneys. So THC, we find that it helps pain. It does help nausea. It does seem to help with low mood or depression and other pain-related things. It does seem to help with sleep as well. And then CBD, they're not really sure where it actually binds to. It almost works like a supplement in the body. It works very generally. And so we actually see they're actually doing a lot of research on CBD now for controlling all sorts of addiction. It seems to affect the way the brain affects cravings in the brain. It can really help people with anxiety. Certainly, I've seen that from a clinical perspective, people on CBD. And CBD has no euphoria or high associated with it. And it is not, it's not intoxicating the way THC is. So it's safe for daytime use, generally speaking. So people can use it during the day and they can get pain relief, help with anxiety, and other sorts of issues. So here are some things that we have had success with in our clinic in treating. So epilepsy, multiple sclerosis, Parkinson's, a lot of these neurological diseases that involve you think of Parkinson's and multiple sclerosis, there's movement issues, epilepsy too with seizures. So there seems to be, and a lot of times we see CBD actually most helpful for those things, helpful with muscle spasticity. For pain and sleep, I mean, pain and sleep are huge. I mean, if you think about with farmers, I mean, lots of manual labor, arthritis is, I'm sure, very common. I don't know any statistics on it, but just guessing. I mean, it's physical work. You're out in the cold. That causes inflammation as well. So even pain, and then pain can lead to disturbed sleep sometimes. And if you manage your pain, if you are in pain and aren't sleeping, there's not going to be a lot other positive that's really going to be meaningful to you. You're going to be sort of consumed by that, especially sleep. If you're not sleeping, it just makes everything worse, and including mental health issues. So all of these things are sort of interrelated with anxiety, depression, PTSD, stress, ADHD. We see issues with sleep with all of these conditions. Even depression is often associated with chronic pain. So these conditions are intertwined and related, and we see general benefits with cannabis. And certainly, we aim to treat people from a medical perspective, and we take all risks into account. But people do see benefit from with these conditions. And then with the gastrointestinal, the inflammatory diseases like Crohn's, colitis, those things respond well to even CBD. CBD seems to have an anti-inflammatory property to it. So those respond well. Appetite loss is great. THC is what we use for appetite loss, and oftentimes that can be associated with different types of treatments, including cancer, AIDS, different things like that. So there's different possibilities for treating different types of illnesses and in different ways. So there's some evidence. Like I said, there's over 400 chemicals in the cannabis plant. So it's hard to study it from a purely scientific perspective, but we're getting better at that. But like pain and sleep, those are two big things that we talked about. I mean, those are just two big things for human beings in general, right? So if you can help those things, it's great. Epilepsy and spasticity, those are two ones that the growing evidence is for. So people take CBD for these. Alleviation of nausea and suppressed appetite during chemotherapy. Like I said, this is how medical cannabis in Canada started. In 2001, it was pushed mostly by people with that had cancer or chronic, it was mostly cancer for chemotherapy, also some chronic pain, but the chemotherapy is where it was first really shown to really have positive effects with helping with the side effects of loss of appetite, pain, and even disturbed sleep pattern. Okay, so we do have some contraindications for cannabis. So if you have a history of a serious mental disorder such as schizophrenia, psychosis, bipolar, major depressive, we on there it says an absolute contraindication, but as far as practice, we take an approach of a controlled method. We talk to people, we see what their what their treatment plan is going to be. We take sort of a case-by-case approach. But there's evidence to show sometimes that THC can aggravate schizophrenia or different types of psychosis situations. So we're very careful with that. Oftentimes we limit THC content in those types of patients. Pregnancy or breastfeeding women, we avoid it altogether. Under the age of 25 because the brain is not fully developed, and severe liver disease. And that just has to do with the medication is not hard on the liver generally, but it is processed by liver enzymes. So if your liver is very severe, it would be something to avoid. Men starting a family, there's limited evidence that it possibly could reduce sperm count. Previous substance abuse, of course, and like anything, cannabis is a substance. It can be abused. There's no doubt about that, but certainly its rate of abuse and the side effects of abuse are nowhere near some other different drugs. Severe cardiovascular deficiencies in acute illness. So sometimes THC in high amounts especially can raise blood pressure. So if you have a severe cardiovascular disease, we probably would limit THC in that case. Okay, so the plant, we have sativa, indica, there's hybrids, which is basically a cross, and ruderalis. That's not too important other than that sativa plants, they tend to have more of an energizing cerebral effect. So sort of a cognitive effect, your thoughts might change, whereas the indica is sort of that relaxing feeling in the body sometimes people describe it as. So indicas tend to work better for people at night that want to relax and go to sleep, and sativa sometimes are better for people during the day that need sort of a boost in mood, but maybe have other pain issues as well. Now we'll go on to the next slide. Like I said, it's very complicated that we've been breeding cannabis now and crossbreeding it. So it's, it's very hard to trace the actual lineage of any one specific strain or cultivar. But we do tend to know what different strains tend to lean towards in their effects. And that just goes from trial and error, really. And in the clinic, we kind of know what strains work best. We even have started to sort of compile a list of strains that might work best for certain conditions. So, but just a general knowledge, there is some trial and error with the cannabis, just because it is a plant medicine. It's not a pharmaceutical. So it's not like a pharmaceutical you get from a drugstore. It's actually a grown plant. So then, like I said, you have the THC and CBD, and you have terpenes. So terpenes are found in all sorts of plants. They give plants their smell and that sort of pungency, and that can work. Those actually have effects alongside cannabis because they've actually created synthetic THC, and the effects that it has are quite different and not nearly as well tolerated actually than when people use the natural plant. So it's sort of interesting. Like I said, they can have independent effects. So different strains can have slightly different effects, all things considered. There are some different terpenes there. I won't go into a depth about that, but a big one to think about is that if you hear the terpene myrcene, that's one that really works for relaxation, muscle relaxation. It's common in that indica strain. And so people that have sleep problems, we try to put that one and find strains that have that one in it. And most of the producers of the cannabis, they list their terpene contents. So there's different routes of consumption. So of course, You have the traditional smoking method. We do not recommend that. Obviously, when you burn something and inhale smoke, there's going to be some bad things for your body in there. Vaporization seems to be a lot safer, although not completely proven safe. Now, the thing about vaporization is cannabis vapes are a lot different than nicotine vapes that have been on the market. They're totally different. They use a different system. So the vaporization of the dry flower is essentially a chamber that heats up the actual dried bud, and then it's actually boiled off into a vapor that's inhaled. And that's similar to the onset of smoking. So for some people who need quick symptom relief, that can be a good method. As you see with taking anything by mouth, it's going to take a lot longer. So you have the sublingual oil extra X. They can take 15 to 45 minutes. Usually 45 minutes to an hour is what we find, because you're not actually going to get a lot of absorbed through your tongue and in your mouth. You're end up swallowing it because it is an oil. With ingestion, as like edibles, cookies, different things you can bake. There's all sorts of ways to make edibles, and producers make them as well. Again, 60 minutes to 90 minutes onset, so a lot longer onset even than that of like a traditional medication. You take a Tylenol, usually it's 20 minutes, 30 minutes before it kicks in. But with cannabis oils and edibles, it's a little bit longer because it's fat soluble, so it takes longer to absorb. And then we have topical use too. So with topical use, it's great. A lot of people see benefits to both THC and CBD topical. You're not going to get a high with anything topical. It's not going to absorb to any extent. But people find it good for muscle aches, arthritis, that sort of thing. So I say smoking is the least recommended. Obviously, it can irritate the respiratory system. Like I said, vaporizing is really the safest way to get that quick dosing relief. And you can vaporize CBD or THC, either or. They're both available in dry flower forms. So how to dose? So we, of course, start slow.
Can I interrupt for just 1 minute there, Adam, on your previous slide? I had a question.
Absolutely.
Yeah, so you were talking about the smoking, it's the least recommended method. Mm-hmm. How much of an issue is that secondhand smoke when you're using this product, say you're in a family or in a working environment?
Yeah, that's a good question. And I don't know if there's a lot of data on the secondhand smoke of cannabis. It's a good question. I mean, I would avoid it for sure. I would do it outside. If you're going to smoke, do it outside, do it away from children, do it away from anyone else that doesn't want to inhale it. So, yeah, it's certainly, I mean, if it's smoke, it's smoke, right? So there's going to be some irritants, some chemicals in there that are going to irritate, whether it's first hand or second hand.
Okay.
Yeah. Yeah. Okay, so we're going into dosing. So there's we dose at the lowest possible, usually about 0.25, 0.2 milliliters. And that's with an oil, comes in a little dropper. And if you were going to use, with cannabis, we generally say like 1 or 2 puffs if it's your first time from a vape, and wait 10 to 20 minutes. With oral products, we say to wait at least 2 hours before you would take any more, preferably 4, because sometimes ingestion takes a lot longer than you think, or if you're not used to it. So what we do is we actually do a routine, like a scheduled routine of increase over a period of probably usually 2 to 3 weeks to get people to their dose. That way they're not overwhelmed. If they're using THC, they don't get an overwhelming, high, that sort of thing. And generally it's with THC at night, CBD during the day. So we have all that discussion in the clinic and how to do it. We give a treatment plan. With cannabis, okay, so there are, you can have some side effects, and a lot of it has to do with dosing, which is why we do that slow increase. But with THC specifically, it sort of can have a dual effect on anxiety. So in the high dose, it can increase, but a lot of people find the right dose actually decreases. A lot of it can dry up your ducts, so dry mouth, reduced tear flow, that sort of thing. There can be obviously some, if you're inhaling smoke, irritation in your bronchi. Dizziness, red eyes, changes in visual perceptions. There can be some. It's not really hallucinations, but it's more so like if your experience can be a little bit different. The decreased sperm count we talked about, dry mouth, slow pupillary response to light, sedation. I mean, that's a big one. That's one that sometimes we aim for, right? Whether it's a side effect or a desired effect depends on the time and what the person is seeking out. Reduced coordination. So you can have some, especially in high doses of THC, we see that there can be some reduced muscle coordination, clumsiness, that sort of thing. The cough with the smoking again. And the dysphoria. So yes, of course, oftentimes people describe THC as euphoric, but there's always, the people that don't like that, and certainly there is people like that, and they don't like THC at all, but they use CBD and have great success. So we try to aim to low to get rid of these side effects by going with that low and slow approach and increasing the dose over several weeks. So the drug interactions that we look for, a big one is blood thinners. So you can see there, warfarin. Warfarin has a lot of interactions on it of itself. So we try to space up, do a 4-hour window between that. Any other cardiac medications as well, we try to space 4 hours away from cannabis. Alcohol, we do not recommend alcohol and THC to be taken together. They can increase and sort of have a synergistic effect that's more than the sum of each one of them on their own. So we don't recommend that. Theophylline, smoked cannabis can decrease theophylline levels. Clobazam, which is often used as a seizure control medication, CBD has shown to increase clobazam levels in the body. And so CNS depressants, like I said, alcohol, barbiturates, benzodiazepines, it can have an additive depressant effect, especially if you use certain strains that are more of that sedating effect. So, like I said, cardiac medications are one that we watch, blood thinners, those are two big ones. And we don't recommend cannabis to be used with alcohol, especially THC. Okay, so that was a quote from a veteran here. I have been using medical cannabis for 4 years. Before medical cannabis, I was taking roughly 10 prescribed pills per day. I was lazy and unmotivated to do anything. Now I have the ability to have a better quality of life with the pain and PTSD in check. So that's just a quote from one person. So take it for what it's worth. But certainly, I can echo that sentiment. I've seen that from many patients here. So why do we have a clinic? Why not just go to the recreational store? Well, like I said, it's complex. If you're not used to it, it can be sort of overwhelming. Certainly in the online world, you can get lost in the information. So you can do it, and if you don't do it right, you could worsen symptoms possibly. Like I said, lots of different compounds in there. Taking the right compound, the right dose at the right time for the desired effect. The different consumption methods. You want to take into account any other medication you're on, of course, and that's what we do here at the clinic. We have experience prescribing medical cannabis, so you have access, like to myself. Always, I'm here in the clinic Monday to Friday. We have our prescriber, Brandy Martin, who does our prescribing, and she's been doing it for close to 2 years now. And of course, as well, we're always have access to all of our staff across the country if there's questions. The director of clinical services, Jessica, she's always available. She's great to work with. So we have access to a lot of that. We have great relationships with the producers as well. So we try to set people up with not only a treatment plan that works best for their medical condition, but we try to take into account finances and the best price for the best product, because that is a real reality for people. And there are different price points, and we work with producers to find the best one that works for the patient. So like I said, we try to make your treatment plan specific to you. We talk. We have our process. You have an appointment with myself, and we kind of talk about symptoms and what might be best, and if you have any history of cannabis use or what forms might be best. Like I said, we have a 7 years experience treating patients, so we have a good sort of database, and we have that recorded, and we pull it, and like Jessica, she always is trying to look at trends and what conditions work best with what products, and so we're actively sort of trying to figure this out. I mean, 7 years is not, it's not a ton of experience, but it's certainly significant considering how new medicinal cannabis is. Like I said, we try to find the best products that work with the client's treatment plan from the different producers that we have. And all of the producers are Canadian producers, and they're fully licensed and inspected by Health Canada. They meet all their guidelines. So if you wanted to become a patient, to get a patient is, I skipped ahead there. So to get a referral, you can get a referral from your family physician. We don't necessarily need it to be from your family physician, though. It could be a nurse practitioner. It could be just a letter from any doctor or even a health professional, even a registered nurse that is explaining what your health condition is, how you're treating it, and what medications you're on. As long as we have that information and it's a valid medical condition, we will work with you to make that a possibility. We have our own prescriber, so we don't necessarily need a prescription from another doctor, but we can work with any sort of medical diagnoses, and if it meets our criteria. So you can register online or in office. So online, Canada House Clinics, there'll be a link to the website at the end, or our office location. We're located on Allen Street, 247, in Charlottetown. So it's in the Mr. Plummer building, if anyone is wondering. Just look for the big Mr. Plummer. We're right in that building. So like I said, after you're registered, we get your referral. There's an appointment with myself. I'm the cannabinoid therapy educator. And so with that, we talk about the cannabis. We talk about the different cannabinoids, THC, CBD, what might work best for your symptoms. Assess if cannabis would do anything for you, of course. It's not a be-all, end-all, but we try to find if there's some people, if they have symptoms and they come to us and they think cannabis will help it, and there's a history of use for it, we certainly will work to make it work with the patient. And we'll do a treatment plan. I will provide we'll get a treatment plan. It'll then be reviewed by Brandy, our prescriber, so she signs off on it. And so our prescriber in Charlottetown is Brandy Martin, and so she would then sign off on the prescription. Then we send it off to the producer that we sort of pick in our discussion, and then the producer then contacts the client, and the patient then orders from the producer directly. So we're not actually involved in the ordering process, but we do provide a treatment plan and the products that we suggest to order. Like I said, you can order online, you can order by phone with the licensed producers, usually 2 to 3 days, even in PEI, I would say 2 to 3 days is standard. COVID certainly slowed things down a little, but it's pretty good. We try to follow up 7 to 10 days after prescription. If you don't have if you haven't ordered by that point, there's no pressure. We don't require people to order. We just like to follow up and see how people are doing or if they're having any issues. So we support research, learning from our patient base. We kind of respect the complexity of cannabis because it is we try to do it in a safe, organized way, but it is a complex plant. There are different compounds in it. So finding a treatment plan sometimes does have a little bit of trial and error, but like I said, we try to do it in the safest way possible. We have very good results. We start with the lowest doses and go slow, and then we go from there. But it's sometimes people have a few different producers, or they try a few different products, and then they find the one that works for them. They're like, I found my routine, and that's great. So it's not an exact science by any means, but I certainly can vouch for people having improvements with their symptom control. Pain, sleep, two really big ones. And I mean, I just think, when working as a farmer, if you're not sleeping and you're in pain, that's going to definitely affect your work. So those are huge for people. So let's sort of do a summary here. So cannabis is well tolerated. Very rare serious adverse effects. It's almost, you cannot overdose on this stuff. They've studied it. The amount you'd have to take it's insane compared to any other medication. Adverse changes, you can have some cognitive changes. Executive function may occur, especially with fetal or adolescent exposure. So that's why we wait until 25 after the brain's fully developed. Avoided by adolescents, pregnant women, nursing mothers, avoided by those risks for psychosis and schizophrenia. And driving impairment is a thing, especially with THC, not with CBD, but THC. Not as on the same scale as alcohol, but we do not recommend driving on THC. And so there are some drug interactions as a concern. It does not disqualify a patient from therapy. We can space out doses. We can work around that. But it is good to be aware of it. Those are just the resources. There is my phone number, or the clinic's phone number and website and email. If anyone wants any more information, certainly feel free to reach out, email, go online and check it out, or certainly give a call or come into the office. And we're happy to work with people. We will talk to you. We'll see what we can do for you. Absolutely. I'm open to any questions, any comments.
I'm going to jump in here. I'm going to give Adam a chance to have a drink and parch his throat there for a minute. I'm going to ask if you fellas would please participate in our poll and get your thinking caps on to maybe ask Adam some questions after that. So once again, the poll is really important to us. It helps us determine if we're on the right path with these webinars, and your input is really, really helpful for us. So please, by all means, just take the minute that it requires and answer the questions for us. So that would be much appreciated. And I'm going to think of a few questions to ask Adam myself.
Absolutely.
So Adam, you were talking about having issues with drowsiness. So in the farming community, where many of the farmers, they're handling heavy duty equipment, they're dealing with things that requires good reaction time. So you had mentioned that it's the THC that they would not be using.
Yeah, we don't recommend THC use when doing any operating of equipment or any tasks that involve that. CBD though is not intoxicating, so we feel safe telling people to take CBD during the day. People do not find it affects their coordination. There's nothing to show that it's intoxicating. So I definitely avoid THC during the day. We often do. People use it often at night just because it does tend to help sleep and pain conditions. And but CBD for daytime use, not an issue with any intoxication or any of that. And even CBD is not sedating, especially in any reasonable dose. Generally not sedating either.
That's good. That's good, because it's since it's such a new way of treating issues. It's kind of nice to get that information out there so that people will understand. So there is, when you're talking about the different hybrids that you're dealing with, you're really specifically targeting which ones will work for people like in the agriculture or the fishery industry who are dealing with mechanical issues.
Yeah. Oh yeah. So we look at the products. So there are products. The producers are great because they divide the products into high THC, high CBD. There are, you can get a mix in between of a balance, a mix of CBD and THC too, but they do separate it. So there are oils that, or capsules even, that are CBD with, you know, very minimal THC, not any appreciable amount. So those ones are what we say are good for daytime use because they're non-intoxicating. The CBD oil, same thing, very high CBD, minuscule amounts of THC. So they've done a good job of separating the two out. And like I said, the CBD is non-intoxicating, well tolerated, and a lot of people do use it daytime use, helpful for anxiety, for chronic pain, inflammation, that sort of thing. Yeah, absolutely. I feel comfortable CBD for any of that. Yeah.
And when you're talking about oils, you're basically talking like just a drop under your tongue or something along that line, or do you have to drink a half a cup of the fluid?
No, I'll show you. Actually, I have one here. One sec. So a bottle this size. So the first dropper on there, if you can see, there's a 1/4 ml line. It's about right there. That's the dose we start off on. So, and then a full milliliter is the dropper, the full dropper. Usually somewhere in that range, people find effective dosing. So it's not a whole lot. And then you might dose 2 to 3 times a day, depending on if you're taking THC versus CBD. But yeah, so doesn't take a lot for a lot of people. Some people, of course, everyone's different. Some people require a bit more, but we do that range, and usually people find effectiveness in that range.
Wonderful, wonderful. And I'm just going to ask one other question before I let somebody else jump in. I'm wondering, because you had mentioned that sometimes it doesn't work. What are some of the issues that you find cannabis is just doesn't seem to have an effect?
For the things, for issues that it doesn't have an effect, I mean, there are some pain conditions that are just where people are in severe pain where they do need some pharmaceuticals. But usually there's some degree of effectiveness. What we see sometimes is what I find it is sometimes absorption is an issue with certain oils, because there are different carrier oils that the cannabis is in. So sometimes I've had people gone up to a mill with a certain oil, and then they switch to a different oil from a different company, and it's working. It's like totally different. It's like they had no effect with the one versus the other one they had great effectiveness with. So for all of those conditions I talked about, like pain, the general conditions, pain, sleep, even managing anxiety, they all seem to have a positive effect. It's just sort of hit and miss. Like some people find it very effective. Some people find it effective. Some people find it moderately or not as much. But there is some trial and error. So it's hard to pick out one condition that I would say we have trouble with. All the things we talked about are pretty good, and there's not one specific symptom that sort of jumps out to me as oh, we can't do something with that. Yeah, it's more of it's on a case by case basis, I would say.
Okay, all right. I'm going to end the polling. Thank you very much to everybody who has participated in that. That's really helpful for me. I'll share the results just so you can see a few of them. And anyone who's interested in, let's see here, anyone who's interested in asking Adam a question, this is your chance. I believe it's in the Q&A section that you can click on the anonymous box and ask anything that you want, and find out now, because you're better than hearing from rumors. This is the gentleman that'll be able to answer any of those questions for you.
I don't anything at all, even if it's silly.
So I see most folks are being very, very quiet. I'm not seeing anything on the chat or the Q&A. Is there anything else you'd like to add before we end this session, Adam?
I would say, if you have any apprehensions about it, I mean, I think that's normal. I think there's, it just wasn't a thing for a long time in Canada, medical cannabis, and we're coming up on 20 years now that it's been legal, and legal from a medical perspective, and then we're, legal from a recreational perspective. So I would just say have an open mind and try to take the whole picture into account when sort of weighing the pros and cons of cannabis versus other sorts of treatment. And talk to people that maybe have used it and tried it and see what they think, because I think the reputation will speak for itself if you talk to people who've tried it.
Okay, we do have one question that's popped up here, and is an attendee who used the anonymous button. Thank you, now I know it works. And they're asking, how long should a person wait before experiencing pain before trying CBD?
Well, I would say try it as soon as possible to see if it works. I mean, if you're in pain and you find you don't have a solution to it, I think CBD is a great way to start for people, because, like I said, it has no intoxicating effects really. People, if anything, people find it almost, it just helps them during the day to be a little bit more calm and focused. So there's no real side effects. The only thing we watch for is interactions with some medications. So it's pretty well tolerated. I would say CBD is very, especially if you're apprehensive about any sort of altered state of mind, CBD will not put you in an altered state of mind. So I would say don't wait. Go for it. Even if if it's an injury, it can reduce inflammation even just in acute injuries. So reducing inflammation is a big thing for people. Like inflammation is a cause of a lot of conditions at the root cause. So yeah.
So it definitely would be helpful in the arthritis that's inflammatory and those sorts of conditions.
Those huge. Arthritis is responds quite well to CBD. That's the first thing I'd recommend for arthritis. Yeah.
All right, I'm not seeing any other questions. I'm beginning to feel a bit like an auctioneer, going once, going twice. I'm going to take this chance and I'm just going to say thank you very much to every single one of you participants who have come in and participated in the polls and asked questions. I want to really say thank you to Adam for coming forward and doing this webinar with us, and he answered a lot of questions for me. I know I was writing down different ones that I wanted to ask, and the next slide would have the answers. So very, very good presentation, Adam. Thank you very much for coming. For the rest of you, I really thank you once again for coming to this one. Please check out our website at peifa.ca and take a look at some of the other webinars, and hopefully we'll see you show up for those. If you have any questions or any comments or suggestions for other speakers, please feel free to contact me at farmsafety@peifa.ca. And like I said, we recorded this whole session, so we will be having these recordings available for you. So if you found this to be extremely valuable and you want to share it with your family, friends, neighbors, spouse, in the future, you'll be able to look at it then. So once again, thank you very much, everyone, and thank you, Adam.
Oh, thank you for having me, and thank you for everyone for attending. Thanks for your time, and thanks for the opportunity to speak. I appreciate it.